Hey, it's Jules with Radio Now 100.9. Another edition of Coping with Quarantine with my good friend, Dr. Kelsea Visalli. How you doing, Kelsey?
I'm doing great, Jules. How are you?
I'm doing good. Ask every time. What's the weather like today in Hartford?
It's so nice. It makes me want to go to the beach, but the beaches up here are not like the beaches that you're thinking of. They're cold.
Well, hey,
They're rocky and cold.
it's been gloomy for like the past week, gonna be like stormy weather. So we really need to make sure that we all are taking care of our mental health.
Yes.
And today we want to talk about debunking therapy myths. I know that there's a lot of myths out there just because what we see on TV and in movies about therapy sessions, you know, that's really all I know about it because I've never been to a therapy session. So I got to ask, is it really like they show in the movies where you lay down on a couch and talk about your feelings?
So it's so interesting. The media definitely glamorizes and has a very specific type of therapy they tend to portray. So yes, there may be a couch and a chair that you can sit on, but for the most part, every therapist has a different style. And what you're referring to is like Freudian psychoanalytic therapy, which is a very specific type of therapy that you can still seek out. But most people, if they just go looking for a general therapist, aren't going to do. Yes, you will talk about your feelings, but that's because usually some sort of feeling brings you into therapy. And it doesn't have to be so how do you feel about that question? There's many other ways to get into how someone's feeling.
So what are some common reasons that you think people don't come to therapy? Do you think that, you know, what they see on TV has something to do with it?
Yeah, I think what they see on TV might send the message that you have to be very, very ill in order to even go to therapy. I also think that maybe they've heard about someone who had a bad experience, or maybe they didn't have the best experience. Maybe when they were a teenager, they were forced to go. Who wants to do that? And so then later on, they're like, well, that's not for me. That was a bad experience. I also think some people believe that they're just supposed to be able to do it on their own and power through. And their family sends that message. And so why would they go? They feel like they shouldn't have to.
Yeah, there's definitely a stigma behind going to therapy. So what would you say to somebody that's not sure if they should go because they think it's just for weak people?
Yes. So one of the things I like to tell people is that everybody needs support. We're social creatures. We're not meant to do life in isolation. Life is really hard, especially during current times with pandemics and stressors. And so even just the act of talking to somebody can alleviate symptoms of depression very, very quickly. It's kind of crazy how quickly it can work. And I also wanted to mention that it's all about how we define strength and weakness. So to me, vulnerability takes a lot of guts. Weakness is kind of more the myth that people think to share their feelings with somebody else.
Yeah, it definitely takes a lot to, you know, admit like, all right, I'm not feeling at my best mentally. I need to get help. And so another myth that we've heard is that you have to be really mentally ill to get therapy, but therapy is for everyone, right?
Gosh, yes. Even therapists have therapists, and they encourage it when we're in grad school during our training. But if you think about it, there's so many different life adjustments that we have to go through. Think about getting married, graduations, new jobs, pandemics, babies, and every different adjustment can bring on stressors that we don't know how to handle because we've never done it before. So for that reason, you don't have to have this diagnosable serious reason to go to therapy. But if you do have something that's more common, like depression or anxiety or any other mental health disorder, it's a great avenue for you regardless of the severity. Does that make sense? Like there's no reason to not go.
Totally. And some people might have had like a really bad experience. They went one time, like a few years ago. They're like, I'm never going back again. But what would you say to somebody that thinks all therapists are the same and all therapy sessions are the same?
Yeah, gosh. So I think if you don't know what therapy's like, you might just assume it's kind of this big umbrella of, oh, you talk about your feelings and that's it. But the first thing I like to mention is you need to find a match for you. So not everybody in the world is going to be a good therapist for me, and I'm not going to be a good therapist for them. And it's not because I don't have the skills. It's just because different personalities and focus areas can match people differently. So a lot of therapists offer free consults where you can call You can call for a one-time consult and you can get vibes from them. You can see what their style is. You can see, like, do you get kind of like comforting vibes? Do they understand you? And I also recommend reading their bios online. Everybody nowadays has some sort of online blurb about what their kind of focus point is and what their specialties are. And you can learn a lot about potential therapists just by browsing through online and looking at pictures.
So you would kind of say that in a sense we can shop for our own therapist.
Yeah, definitely. So it's such an interesting concept, right? But think about how you look up a medical doctor. You might look up some reviews. You might go where a family member tells you to go. A lot of people go where your insurance is accepted. And it's kind of a similar process for therapy. You want to look through what their focus area is, if a family member maybe vibed with them well. And then you want to kind of see, are they offering what you need? So if somebody specializes in OCD treatment and you really want to talk about relationships, maybe they're not the best fit, but maybe there's someone else who has a specialty in a variety of different areas. And another thing I'd like to mention is we refer. So sometimes people come in and it's not that they necessarily dislike me, but maybe they're not making the progress they want with me. I'm happy to refer them to somebody who specializes in an area that might help them even more with their presenting issue.
Yeah, I guess I didn't really feel like the shopping around for a therapist was a thing people did, and even therapists recommending other therapists. That's so cool.
And I want to add too that it's always helpful to give it a couple tries. So definitely tell your therapist if they're not offering something you need, because we can't really adjust and meet your needs if we don't know what we're missing in the first place.
Right. So what would you say to somebody who thinks therapy won't work for them?
Definitely. So have they tried it before is generally the first question. And if they have, there's probably a variety of different reasons why maybe they didn't like it. And that's totally valid. But what I say is that we know therapy is empirically validated, and we know the therapeutic relationship accounts for so much change in how somebody's doing. We also want to look at options like maybe they need medication as an adjunct to therapy. Maybe they just need to figure out ways to get more active in the community. So I tell people it's okay to be ambivalent, and it's okay to not be sure about therapy, but still kind of giving it a try and being open with your provider about, hey, I'm kind of nervous about this. I don't think it's going to work. I can work with that a lot easier than somebody who comes in and doesn't share that with me.
Right. So a lot of people, think that therapy is too expensive, especially in this pandemic. We're all a little strapped for cash. How expensive is therapy?
Yeah, it's such a good question, and it can kind of range. But one thing I wanted to definitely mention is there are a lot of options people might not know about. So a lot of therapists accept insurances, and a lot of websites are set up so you can enter your insurance. Right now with the pandemic, a lot of co-pays are being waived. So basically, if you call your insurance and say, hey, COVID's stressing me out, I need some therapy, you might not have to pay a dime out of your pocket. Insurance would just cover it. There's also, I always tell people when they're going to meet with a therapist to talk about pricing, do it right away. Don't do a bunch of sessions and then talk about it, but that shouldn't happen. That's not ethical. But ask them if they do what's called a sliding scale. And with a sliding scale, you can kind of compromise and meet where your salary is and kind of lower the price if the therapist is open to doing so.
That's a really interesting concept. I've never heard of the medical field having a sliding scale for payments. That's so interesting. So is there a time length for therapy? Some people might, go to one session and think they're supposed to be, fixed of all their problems. And then some people might go once and think that they have to keep going for the rest of their life. Is there some type of time scale for this?
Yeah, and it differs so much between person, but you have so much say in that. Therapy is definitely a collaborative process. So you should never be kind of feeling like you're forced or obligated to keep going back unless you're court ordered, but that's a very rare kind of different thing. But we'd say the sweet spot can range. Generally, it's more than one time. So if you go in frustrated that things aren't better after one time, that's because we're kind of growing and developing a relationship with you. And in the intake, we're mostly getting to know you. A lot of people start to see progress after 3 to 5 sessions, though. So that's really quick. Wow. And a lot of people feel relief just after one because they finally got it off their chest and they're not having to hold it kind of in so much and feel that burden on their shoulders.
So if we're considering going to therapy, and we're not sure how to really start and go about it, what would you tell somebody seeking therapy?
Definitely. So I found some tools and resources that I thought could be really helpful. So I mention this a lot, but once again, Psychology Today is so amazing because right now it's telling you everybody who is doing online therapy. So don't think just because of the pandemic you can't get support. We adjust, we adapt, and there's a lot of confidential platforms for therapists to do therapy online with you. So Talkspace has this really helpful article. It's called What I Wish I Knew About Therapy. I'll link it in my Instagram. It's a really good way to go through. It debunks a few more myths about therapy from a person who actually was hesitant and then finally went to therapy. There's also an article from Psychology Today called How to Find a Therapist for You. And I'll just summarize it super fast. There's kind of 7 main tips. So asking around for people that have seen therapists, checking out online, looking at pictures, kind of seeing what does their space look like? What's their vibe like? You can pick if there's a gender preference, their approach to therapy. Generally, their bio should say their approach. And then also you can call and consult and notice how you feel during that consultation. Does it feel like it could be a good fit?
That's very good information. Thank you so much, Dr. Kelsea Visalli, helping us debunk therapy myths. So how can we connect with you?
Yeah, so you can go to my Instagram. It's at dr.Kelsea Visalli. And then my YouTube, where I do some self-care and intuitive eating kind of vlog things, are also linked to my Instagram at the same name.
And we talked about intuitive eating in the past. Last week, we discussed coping and dealing with stress. If you missed any of those discussions, you can find them at radionowindy.com, or you can just get out your phone right now, text Jules, Jules, to 52140. Remember, you can listen to us with the Radio Now app, listen live at radionowindy.com, or tell Alexa to open Radio Now 100.9.